Schwarzenegger was going to retire from the acting business and passing the baton over to The Rock. You know, he was the next action star. He said, "I hate it when people are bigger than me." So tell us about that. You weren't LifeWave believers when you were first introduced to the patches. You were rather skeptical yourselves. What did it take to convince you that these patches were real and they were actually working?
Putting them on my body. Nicholas called and started telling me about some patches, and then he said something about crystals. I really wasn't paying attention, which is a bad habit. My wife tells me I have. But I just thought, oh, for heaven's sakes. And I was trying to figure out how to get off the phone with him. But he did mention glutathione, and I had been studying about glutathione to help Parkinson's patients, and so he got my attention. And so this was like October, and he finally was able to get with me in February the following year.
Now, I take it from that comment that you have a number of people with Parkinson's that are in your practice.
I do have a couple of Parkinson's patients, yes.
You know, and it's really interesting. Now, I want to make the distinction that we're not claiming to treat Parkinson's disease, but what Dr. Dennis is referring to is that when people have Parkinson's, what's been shown is that they have depleted levels of glutathione. And glutathione is linked to the immune system. So as the glutathione levels come down, the body can be attacked and free radical damage can damage the nervous system. So what have you seen, by the way, with these patients that have been using the glutathione patch?
Well, I'll tell you specifically one case, and again, we're not treating Parkinson's, but he had advanced Parkinson's, 77 years old, retired pharmacist. And so I had a conversation with him. He says, well, I know that basically the medical concept is to manage this disease, the symptoms, until I die from the disease. And I said, well, how would you like to try something a little different? So he said, well, what do you got? And so I explained to him how the patches work, and I gave him the brain protocol. And so he purchased energy patches, glutathione, and neon, and he started wearing a baseball cap. So he put the patches inside his hat. And within 1 month of daily use, they had a big family party. All his kids and grandkids came over, and every single one of his kids were wanting to know, what are you doing, Dad? You look great. You're walking better. Your face looks better. Your arms are swinging better. In every way, that they all commented. And so he called me up and said, can I get some more of these?
Caroline, what's it like seeing these little miracles happen every week in your practice?
It's normal in our practice, but it didn't start out that way. I do my own little thing in the back office. I'm involved with all of that. So when a lot of times when the miracles are happening, someone will run and get me and say, "Come look at this," because I know when they come in, they, chronic back pain or whatever is going on, and I get to experience that. When he has his workshops on Tuesday nights, I'm holding a workshop in the back with the people that I'm dealing with the diet clinic, and so I'm not always out there to learn, but I've been caught a few times with nobody around to defer to people who need the patches to, and I'm like, it's up to me, I have to do this. So I'll get out a book and I'll look and see, okay, because some of the people that I'm dealing with are really sad and stressed out, and so I'll go grab a neon patch and put it on them, and they're like, what is that? And then I have an opportunity to show them the little pamphlet and talk to them a little bit about it. So I also get to be involved not only in seeing the miracles, but I've got to help, even though I feel like I wasn't as good at it as him or Tanner at the front desk or other girl in the office.
Now, what you said is really important, though, in that all you had to do was pull out the instructions and look at an illustration, and this is where you apply the patches and you put them there, and that's it. We show all of that in the instructions. So it's really anybody that's just getting started can do this.
Oh, exactly. One day I was at the office by myself, just getting an order of things for somebody with my part of the practice, and a woman shows up, "Is Dr. Cathcart here?" And I could tell how stressed out she was. I said, "No, I'm sorry, he's out of town." And she said, "I guess I'll drive myself to the hospital." I said,
sometimes, I would have to admit, I had this one case in Australia, and this fellow, as a matter of fact, he had Parkinson's disease, and he was completely debilitated, hunched over, could barely communicate, and his wife brought him up to the stage in a wheelchair, and I thought, what am I going to expect, to happen? I can't even communicate with this fellow and ask him if his pain level has changed. And I almost did not apply patches for that. There was an audience of, I don't know, 400, 450 people. And so I was really in the hot seat. And these were skeptical Australians. So I thought, oh, I'm going to apply these. He won't even be able to say anything, and this is going to be a problem. So shame on me. But anyway, I ended up applying the patches, and the recovery was just absolutely incredible. After an hour, he was back up walking and able to speak normally. And he and his wife went out to dinner that night to celebrate. They went out dancing. That's actually on YouTube video, by the way. But did you ever have a situation in your practice, Dr. Dennis, where you thought, oh gosh, this is really pretty bad. I don't know if the patch is going to help. I think they surprise us sometimes, right?
Most of the time I'm surprised because sometimes I think there's no way this person's a goner. But I always just, well, it has completely changed the way that I practice chiropractic. I love chiropractic, and the one thing I love about chiropractic is people come in and they're desperate for help, and you help them, and it's immediate. But the response now is that immediacy is tenfold. So if I have a patient come in that has a full-blown migraine, and you've seen these people, they're wearing sunglasses, and they want you to whisper, and they wish you would turn the lights out. And usually what I would do was chew them out. First thing I was like, 2 days ago you knew this migraine was coming on. Where were you? I was here. You were not. And so when someone has a full-blown migraine and you adjust their spine, if their pain level is a 10, you can adjust them, and they might walk out of your office at a 7, and they're grateful because you've given them some relief. But now, they come in, I chew them out, and I adjust their spine, and then I ask them, I say, give me an assessment where you're at now, and they'll usually say I'm like at a 6 or a 7 after the adjustment, and they're grateful. Well, now, the frosting on the cake, I say, now I want you to go to the front desk and talk to Tanner, and he's going to patch you, and let's see if we can bring your pain level down more. So, of course, they're interested. So they go to the front desk, and Tanner or Giovanni, whoever's at the front desk, patches them. And it is amazing to watch people walk out of the office just giddy because they walked in with sunglasses on and in a 10 out of 10 in pain. And the great majority of the time with migraines, they walk out completely pain-free.
That's awesome.
Whoa.
Chiropractors, naturopaths, acupuncturists, they feel as if, oh gosh, if this works so well, I'm going to be out of business. And it's actually just the opposite, because you still have to provide the diagnosis. The adjustment obviously has tremendous value, and these are tools in the overall healing process.
When you think about the nervous system and how it functions, first of all, the Eon patch helps the nervous system function better. And so, in every way, their health improves when they're wearing an Eon patch. I try to wear one daily. The adjustment improves the way the nervous system functions. It removes interference from it. And so, I've talked to chiropractors that feel threatened sometimes. That, well, if I use this, it's going to put me out of business because I'm a pain specialist. I'm like, you're not a pain specialist. You're a nervous system specialist. And these patches are only going to enhance what you do. And it has improved referrals. People say, hey, you got to go check out this doc. He's got these magic Band-Aids. It's a fantastic tool that enhances my practice because I'm supposed to be helping people be healthy. And these patches are fantastic for health.
One last question for your lovely wife. You've been married how many years now?
Almost 28.
28. And the two of them are still like young school kids with their romance. How do you keep your marriage alive? Is it Yes, dear, what's the secret?
For him, it's yes,